for all having me here in the middle.
In the middle, you let me know when you're ready.
Screen. So thank you for having me here. It's always a pleasure to come out and speak to different Rotary clubs. So before I start, I'd like to know, with a show of hands, who's heard of Rotary before? So the farther I go away from my office, the less Rotarians know about Rotary. So I love coming to clubs like this and sharing what we do, and then hopefully you'll share also with your fellow Rotarians. So Rotary is a 22-year-old organization. We were founded in 1989 by Dr. Mark Campbell. He was at the time a Campbell Rotarian who was seeing patients for free in his office, and he was located over at Agnew's in Santa Clara, if you're familiar with that. And he went back to his club and said, there's such a tremendous need for people to get free care, will you help? So the club joined on board, and then District Governor at the time, I don't know if any of you know, John Fisher, who's still a Rotarian in Aptos, but John Fisher was District Governor, and with the two of them, they went out to many local clubs, raising money, getting support, and the first clinic was then opened in Santa Clara, again back in 1989. And with that, over years, we're now at actually 11 free medical clinics all through the Bay Area. We go from Monterey to San Rafael, and our two newest clinics, one opened actually this year and one 2 years ago, Concord and Pittsburgh. So our distance is spreading a little bit. Like I said, I'm out in Los Gatos, and there's also some very active conversations about opening a clinic in Hayward in the near future. So our clinics are absolutely free to people. It's basically for people without insurance, without health insurance. These are people who either can't afford their own insurance, their employers don't provide it. Most of our patients are working people who just don't have the benefits, and also can't afford going to the doctor on their own and paying the high cost of medication. And if Rotary wasn't there in all these locations, most of our patients would eventually end up in the emergency room, and that's kind of our goal, is to avoid that, having them show up at the ER. You bog down the system, but it's also a huge, huge cost to taxpayers, and by that point it's usually an emergency for the patient. And what's unique about Rotary is we're volunteer driven, except for I'm full-time. I have 2 part-time staff in my office. Other than that, at each of our clinics there's on average 1 part-time person, and they're really stipend. Everything else is volunteer. We have over 1,500 volunteers, from doctors, pharmacists, nurses, registrars, a lot of interpreters depending on which community we're in, and it's huge. It's just absolute word of mouth. You know, we're kind of unique. There's not many clinics that are actually free like that. We don't bill back insurance at all. And we actually just honored, 2 weeks ago, we had an event to honor John Fisher for everything he's done for the last 22 years. He's still very much part of Rotary. He volunteers at our Aptos clinic weekly. He's still on my board to this day, and he just was on an airplane a few weeks ago in Southern California spreading the word of Rotary. Even though it's not under my umbrella, there's actually New York Rotary. Most of our clinics are open 1 night a week. Since this is volunteer, we've tried some weekends. Nighttime works much better because these are volunteers that are coming after work. We do have a couple clinics that are open a couple nights a week, and we have 1 full-time clinic that's open 51 hours a week in Mountain View. And it's absolutely huge to be open that many hours on volunteer support. Our closest clinic to you is our San Leandro clinic. I'm not sure if anyone's familiar with the Davis Street Family Resource Center. So our clinic is housed there. Rose Johnson, who's the ED of Davis Street, is also the founder of Rotacare, and her husband, Bill McCammon, the past fire chief of Alameda County. They both were founders of the clinic and still very, very active. Bill's actually my president of the board today also. So with that, I want to kick in. I have a 5-minute video just to show you. It gives you kind of a glimpse of the volunteer side and inside the clinic and patients. You have to hit the play on your phone. That should sort itself.
That would help.
might have died. Not just because I couldn't breathe or the blood clots were forming in my lungs, but the human spirit gets broken. I've learned that clinic, especially one such as Rotary, is not about doling out pills. It's not about inoculating your children to be ready for school. It's about regarding the entire person without judgment and providing what they need, whatever it be.
Well, if Rotary wasn't here and there weren't other clinics that they could go to, these people would continue to get worse and would probably die.
Anybody can show up in an emergency room anytime and get seen, but sometimes the waits could be 8 hours, 12 hours, and the emergency room is not at all prepared to deal with chronic medical problems like diabetes, hypertension, asthma. They're really just designed to give people a quick fix. And the goal of Rotary is to try to provide a medical home for some of these people who have nowhere else to go.
There are millions of uninsured children in this country, and millions of uninsured adults in this country. And you know, our health insurance costs are so high that the average person cannot afford to provide health insurance for themselves or for their families.
Many of these people are holding down jobs in our community.
It's getting bigger and bigger, but 26,000 free visits at all of our clinics, and that's absolutely huge. We do have 51 million uninsured Americans, you know, but we're doing our piece here in the Bay Area with Rotary. And even in 2014, you know, we're still expecting with healthcare changes that there'll still be another 20-something million uninsured. So Rotary will still be there to provide that care. And what's unique that I always like talking about, as I said, is not only is it free medical care, and a lot of clinics do announce free. It doesn't always mean 100%, but we do not charge for anything. At most, to see a little can on the desk that asks for donations from patients. And being volunteer driven, I don't know of many other clinics anywhere in the Bay Area that have free clinics, and we span across 7 counties. And the last thing is we don't receive any government funding whatsoever. We don't get reimbursements. We don't bill insurance for Medi-Cal, Medicare. When the federal stimulus money came out, we're not eligible because we're not a federal program. So Rotary is definitely unique. The major challenges for us are always, of course, funding with any nonprofit, but finding the medical volunteers, finding the doctors and the nurse practitioners and physician assistants. Those are always the challenges from being open one night a week.
Of each one of the clinics?
I have oversight of all the clinics. We hold the license at my office, my level. We hold the all providers are given a malpractice. We have a huge policy book. We have a quality assurance program. Each clinic, though, as far as the fundraising piece, to raise money for us. But yeah, it's one central organization, all reporting up. Each clinic has a manager that reports to me, and then the board of directors above.
Now, are the
So
doctors and the health professionals, are they all volunteers as well?
they're all volunteers. So it's over 1,500, so it's huge. And it's one of those things, it's hard to get doctors for a lot of reasons, and a lot of times it'll be because of the long hours, or you know, a lot of doctors will complain of burnout, or just that you may not want to volunteer doing what you already do all day. But once you can get the doctor to come into the clinic, their eyes open, it's very different. There's no more paperwork that they deal with in their office. There's no more rule of 15 minutes to get them in and out. And it's really just about what they can do to serve. And they'll tell you all the time, I heard it, you know, in the video of patients tell me thank you. And what that means is they're truly, truly appreciated, and it's why they took their oath. But yeah, they're all volunteers. Yeah.
Yes. What's a typical budget for a clinic, and where does the money come from?
Typical, our budgets are so all over the place because of being open one night a week or full-time. If it's a clinic that is open one night a week that has a hospital supporting x-rays and labs and that sort of thing, you know, it might be $60,000 for the year. Money comes from foundations, grants, individuals, Rotary clubs. I probably have about 30 different Rotary clubs that make donations, most directly to the clinics, and some will do it also to my office. It's harder for me to fundraise because I have all the boring. I have the database and the quality and the accounting, but most clubs, that was the other thing I didn't mention, each clinic has a Rotary club that is there to support them, whether support comes in kind from donations, volunteerism, local restaurants donate dinners to the clubs, Rotarians pick it up, but yeah, each clinic is required to have a quote time.
Great. Well, thank you.
I just asked, what are your greatest